Hello my dear students, here we have Dr. Prachi with us, who is PGI rank 40 and NEET PG 2019 rank 161. We would like to congratulate her for such an excellent result. She has basically proved that a student who is putting on hard work will have a constant rank like this. She is currently pursuing her ophthalmology in PGI. I would now like to ask her to share her journey.
Thank you so much, sir, for the congratulations, and I feel really blessed and happy and excited to have achieved amazing results through the entire 1 year of preparation. And first of all, I would like to thank God for I feel I am really very blessed to have done this. I want to thank my parents, without whom I wouldn't have been anywhere. All the DAMS teachers and faculty for the constant support and encouragement, not only for the content delivery and the knowledge they imparted, but also for being there always even when we were depressed or a little worried or stressed, and they would always come up with something to push us forwards. And so also I would like to thank my college, Lady Hardinge Medical College. That also plays a very important role for where I am today, and all my teachers, my batchmates, my seniors from my college.
Great. So we'll dissect your victory speech first, one by one.
Yes,
parents, we'll start with them. What was very specific with your parents which has made you so successful?
So my parents, so there are many times in this preparation phase, because it's a very long phase. It needs you to be constant, consistent and motivated, and there would be times and phases where you will feel low, you wouldn't want to pursue it anymore, and you need to surround yourself with such people like your parents. They can be your best support, and they would always push you, and even small words of wisdom or some motivation message from there just hits you, and you keep on continuing. So they are the most important. They were my go-to people for anything I felt ever.
Okay.
So they were always there and supporting me. So I was very grateful.
Now, siblings.
So I have a younger brother.
Okay. What was his role in your success?
So he would always cheer me up. He himself has a very cheerful attitude towards life. He's very relaxed. So he would somehow come up with something very funny or something very tricky, and it would just make me smile and keep me relaxed and grounded. I would look to him like how he is dealing with. He's currently in final year MBBS.
Okay. So he himself is going to be a doctor. So
yes. So
okay.
He would deal with things very easily, in a very relaxed and funny way, and I would just connect with it so very well. And he would be like, you would do it. I mean, तुम नहीं करोगे तो who will do it? So he was very encouraging.
Probably वो जो statement है ना, तुम नहीं करोगे तो और कौन करेगा? That is probably what pushes all of us.
He had full confidence in me.
Okay. Now, college. Let's come to the college.
So I feel like yes, the coaching is important. The concepts which you get here, it's very important for your PG entrance and MCQ, but nothing can replace your 4.5 years of MBBS. That is really very important. The amount of training and the drilling I went in at LHMC, I think that has a very important role. So even if I was facing something difficult in my preparation phase, I was not that taken with it, or I wasn't that worried, because I had faced a similar situation in my college, and it was a difficult time at LHMC, but the teachers and the faculty, they drill you so well, they train you so well that you can take on anything. It's like you come out from Hardinge as a Hardonian, so you can face difficulties. And even the seniors and the batchmates, they keep on pushing the limits so high. They've all performed so well, and you look up to them and you feel that if they can do it, why can't you? You're from the same college, you have the same teachers, so they are also they give you the courage and the confidence that if they can do it, you can too. So I'm very thankful to my college.
Okay.
So.
Now, you used to stay in the hostel, or you were a day scholar, like from Delhi?
So I used to stay in the hostel for the first 2 years.
Okay.
And I had my relatives in Delhi, so sometimes on and off there, but mostly in the hostel.
Okay. Now, hostel is a very important place where we either get distracted or we either get constructed.
Yes.
What was your take on the hostels?
So the hostels in Lady Hardinge are not really very comfortable, as I would say, but it's both ways. Sometimes you get distracted, sometimes you get a little disturbed, but you also get to be with so many people and you meet new people there that you cannot get when you're sitting at home and staying at home. So you learn so much from other people coming from so different places, and how what's their approach towards studies, or in general towards life. You get to learn also a lot. So it's a mix of both, I feel.
Okay. So now, during your preparation, you were an isolated person or you were in the group?
So I was mostly an isolated person.
Okay.
I studied mostly on my. It's good if you can get a good group and people who would match your
frequency.
Yes. So if you get that, that's definitely better, because you sometimes feel that you need someone to discuss things with, or you can just learn it up and tell them, or they can tell you, and it's easier. But I was mostly an isolator. I would study on my own.
Okay. Now let's come with DAMS.
Yes.
Your journey with DAMS, when did it start?
So it started in 2016 when I joined the foundation course in my third year. And I just joined it because all my friends were joining it, not per se for PG entrance. I joined it the weekend course, and that I did my third and the final year subjects then. So I couldn't read much of it simultaneously with the classes, though I tried to do major subjects like medicine, gynecology, pediatrics, radiology, surgery, and also the third year subjects. I read them once or twice with the classes, and particularly in final year, it was really very helpful, the notes. I did almost all my final year notes in final year itself. I would first read the DAMS notes, and then I would read a proper textbook after that. And it was helpful. Not only, I was not thinking that I am doing this because I have to get into, to clear an MCQ exam. It was also very helpful for me to know the concept. It was helpful for me even in the clinics, in the postings, to know those small things. And so I did my DAMS notes pretty well 2 or 3 times in the final year itself, and then I went back to the textbook. So it was an added thing, and it helped me read those textbooks also, the standard textbooks also, very easily. So I felt that was one important advice which was given to me by my seniors, to read the notes in the final year, and that helped me perform well also in my final year. I could get a good score in my final prof also.
Okay. Now, there are many theories which goes on that PG preparation is different from the MBBS curriculum. You joined as a foundation batch in the third year. Now, you shared your part, like, did you find it to be too much different? Or was it like a synchrony or a base which we frame it for the PG exams?
So, frankly speaking, I didn't feel it was very different. It was just a base on which we were building for the MCQs also, and I felt even in the MCQs it's not very different from what your MBBS. That's why I would stress again that if you do your MBBS well, I don't think it's going to be much difficult for you to do even well in your MCQ or competitive exams. It's only the approach is a little different. You need to be more objective in your studies. You need to know the correct answer. But if you have your good concepts which you gain in your MBBS, then it wouldn't be that much of a difference. I don't feel it's very different.
Okay. Now, your take on tests. The DAMS, subject-wise test, class test, grant test, your take on that. Were you a regular person testing yourself, or you were a person who tested yourself at the last, just on the 11th hour of the exam?
So I wasn't testing myself from the very beginning, but yes, towards end 2-3 months before AIMS, I started taking the grant test, and I was enrolled also in the test and discussion course. I was following that very rigorously, very well. I was following that, and towards the end, yes, I started practicing these grant tests. I tried to do probably all of them, and the video discussions after that was very, very helpful. It doesn't matter how much you've studied, how much you know, what rank you are getting. Even if you've just done 3 or 4 subjects previously and you're taking the test, just be confident, and it will give you the confidence you can do those 3-4 subjects well, because you'll be clear that yes, my content and my concept is not lacking, at least in this I am done with this. So that will give you that confidence, so you can start doing the exams irrespective of any rank you are getting. It doesn't really matter, and you should look back at your mistakes. You should listen to those videos, particularly for the subjects you feel you've been lacking, you feel a little apprehensive about, you feel that's your limitation. You should obviously go back to the videos.
So you were a TND student as well.
Yes.
Now, how did you approach the TNDs? Because generally we see the pattern that the students they come for the discussion part, they would not give the test. And out of 10 times, 9 times the reason is that we were busy, but actually they were not busy with an academic work. They might be busy quitting the test. So what was your take? How did you manage the test?
I did not completely follow the TND's schedule as it was given to us. I had my own schedule. I was following that because I wanted to do the subjects which I was weak in earlier, but I always took the test, because in the exam also you're not going to get questions which you know. I mean, majority of questions would be, you might not be knowing the right answer, but you have to just somehow arrive at the right answer. You need to learn the habit of ruling out the options, or you need to somehow figure out that this, yes, probably this is the right answer. So I would always take the test, whatever it may be, and even if I wasn't prepared for it, I would be studying some other subject and the TND would be some other subject, but that would also give you a time, 1 hour time to practice also some MCQ, some new questions which you haven't seen in the past. That will give you an opportunity to do that, test your speed, test your accuracy. So that
means you were very sincere to give the tests.
Yes,
even though you followed your own schedule,
yes,
you were sincere to
I would just take the test as any other, because exam also you will get new questions. You don't know, they won't be all crammed up questions. You can't just go, you have to apply your brains then and there. So that will give you a time to think and apply whatever you know in the past.
Okay, good. So it's a very important message for all of those who are hearing to this particular video. Give the tests. Even if you're not prepared, give the test, because in the exams you are going to face many questions which probably are very new, and it's all about ruling out the 4 options. Even many of us might not be knowing the answer to a question, but the art of ruling out the answers helps us to get a positive foot and also to score on a question. Now, your role in the DAMS club.
So in the DAMS club, initially when I was doing my first reading, first revision, I would, or I was practicing questions, if I would come across some doubt, I would always put it on the club. I would tag the teacher, and I'll always get the answer also. So that is very, very good for solving your queries or concept. Any doubt you have, you can easily ask that, and the faculty would always be answering it. And also the updates we used to get, they were also, I initially couldn't follow it much, but yes, towards the end I was following them. I would save them. I had a folder, and all the videos also, even the motivational talks when Dr. Sumer or Dr. Deepti would come up live on club, I would save them, I would listen to them. So it was helpful in all the ways, for your queries, for the information, and also in general for everything.
So how did you snipe the distractions? Because generally we say the moment we step into the club, we also have a view to go into the Facebook. So how did you snipe it off?
So I don't know, my Facebook would only show me DAMS feeds only. I had nothing else coming on my news feed. It was only DAMS and DAMS posts. So yes, and even if you spend just 5 minutes looking at something else, it's okay. It's for a change, it's fine.
Okay. Now, eMedicos.
So eMedicos, and also particularly I made use of eBooks app a lot. eMedicos for, again, doubts, for the posts that the teachers or faculty would post, some interesting questions. The previous year papers, very, very, very helpful, particularly for AIIMS and PGI. NEET can be a little unpredictable, but yes, AIIMS and PGI tend to repeat questions, and you get right answers, genuine answers from the right sources. You don't have to look around for the answers in any other source. So that's very good for the previous year questions. Also, all the discussions, all the images that were there in the ebooks app, there was the complete, all the DVTs which were added on into it, and all the AIMS discussion, PGI discussions, the derma radiology images, everything was there. So I would look up at it quite frequently, particularly towards the end.
Okay. Now, particular subjects. Let's start with the first year.
So first and second year I didn't attend here, so I did it on my own. But yes, the TNDs were very, very nice, particularly anatomy, Dr. Pawar, pathology, Dr. Diksha, pharmacology, microbiology. In fact, all the subjects, the test and discussions were very, very helpful because I was doing them on my own. So that gave me, that was easier for me to clear my concepts.
Okay.
And I did my third and final year subjects here. So ophthalmology, Dr. Ruchi's notes, nothing else asked apart, like outside that. It's you just have to do that much, and that's done in there. Dr. Deepak's ENT notes, then Dr. Deepti's Obs and Gynae, that's just amazing. Plus also the test and discussion course. You don't need to do anything apart from that. You just have to know whatever there is there in the notes. Dr. Arvind's medicine, the way he clears your concepts and also the way he gives you the notes, they're so well tabulated, so easy to read. I did them in my final year. They were very, very helpful for me in the final year itself. Pediatrics, Dr. Siddharth's notes, not only the notes are good, but also he gives mostly the AIMS and PGI previous year questions also in the notes itself. So you can just read those, or you don't need anything else apart from that. You can give a quick reading. Ortho, Dr. Tashar's notes are very, very nice. And radiology by Dr. Sumer. Particularly, I loved his DVT session. It was very well integrated, very basic, very nice, crisp. And surgery, Dr. Rajiv Tiwari's notes were my go-to source for GIT surgery any day. So all my surgery was from there itself, from the notes itself. And dermatology, Dr. Saurabh Jindal, I attended his TND. It was very, very nice. And
so basically that means the notes are a very important integral part, what you mean to say.
Yes.
Now, just deviating from this. Now, these days, we have now developed a habit to do a meta-analysis.
Yes,
now, that means I get data from multiple sources and then I just try to create my own note. What is your take on it? Because you have been a person who has got continuously a very good rank.
Yes,
now, were you a student of meta-analysis or were you a student who did a cross-sectional study?
So I was not at all a student of meta-analysis. I wouldn't take so much of time to figure out where I have to do this from. I knew that the content the teachers are delivering is the best, and that is what is required. And if you don't, if you're not confident, you can study and you will ultimately find out the questions are from there. Everything has been given to you in the class itself. You don't need to look for anything else anywhere else. So you don't need to really waste your time on anything. You can just stick to whatever has been taught to you in your foundation course, add it on with your test and discussion, the DVT, and that's it. Nothing else you need to know. You don't have to look around for other sources here and there. You'll just be wasting your time. It's not required.
Now, quality or quantity, your take?
So quality, definitely, yes.
Okay. Medicine or surgery? If I give you one day and I ask you to revise medicine or surgery, what will you pick?
To revise one subject?
Yeah.
For
the exams, and you say, okay, this is what I would do a day prior to my exam.
So I would say surgery, because medicine is more conceptual.
Good.
And once if you know the concept, you know the thing, it's not much to learn in medicine. And also in the exam, there would be new questions framed out. They would just give you a situation, what would you do? So that you just have to apply your brains in the exam itself. You don't really need to read medicine to be able to answer it. Surgery, yes, there are certain things, particularly the latest question that has been asked, like sutures and needles and all those sizes. You need to know all those things, color coding. So that is a little part which you probably need to learn or revise a day before the exam. So yes.
Now see, we talk about integration a lot. Okay. Now there are many students who think that medicine is an isolated subject, surgery is an isolated subject, anat is an isolated subject, physio is an isolated subject. What is your take on it?
So initially when you start preparing, because you've not touched your first and second year subjects for 3
Almost
years,
3-4 years,
so
yeah.
initially you would feel, yes, I'll do this and this separately, but ultimately once you're done with your first revision, you would find that everything would fit into place, and everything, you can arrive at an answer to a question without even knowing which subject it is from. You would somehow know because you read it somewhere, you will be able to integrate it somewhere. Like particularly for medicine, I feel you really, once you're done with your physiology and your pharmacology and pathology, you really don't need to sit and read medicine as such, because it would, somewhere you must have read it, it would be integrated. Initially you would feel it's all separate, but it's integrated in the end. Yes, there are few things which you need to do for particular subjects, but most of it you would be doing it multiple times in somewhere or the other, so you will get the answer to the question without even knowing which subject it is from. Yes.
Now, textbooks. Were you a person who used to read it cover to cover, or picked up chapters or picked up topics? How
so
did you
I
manage
would pick up chapter. Like you cannot. I felt. I mean, the standard textbooks. I read. I tried to read almost the main textbooks for all the subjects in my MBBS, but obviously you cannot read them cover to cover. There's no point also, and but you can do at least the important topics which are being taught in your class, which have been discussed at your postings, or some good case you see. You cannot read it cover to cover, but definitely the ones which are discussed more and all, you can do them very well from your textbooks. Yes.
The exam,
Yes.
the NEET exam or the PGI exam. What was your strategy during the exam?
So NEET and PGI, they have a different pattern, both of them. So for PGI, I had not really prepared very well. I wasn't preparing for it for a few months. I just had 1 week after my aims for the PGI. I solved the previous year questions, and 2 things I was very clear about, which was told to be by my seniors, is one is that the exam is lengthy. So I was just focusing on completing my exam. At least I should be able to complete the exam on time, because it's 250 questions, 5 options. Every option is an answer. You need to think about it. It's not online, so you need to color all the OMR sheets to integrate all of that. And secondly, do less negatives, because PGI is 100% negative marking. So these 2 are my strategies for PGI, finishing it on time and trying to do less negative. For NEET, it was just the opposite, because I was told by all the DAMS faculty and even by my seniors to just go all out. Don't worry about the negatives, because it's just 1/4 negative. You should trust your intuition. If you could just rule out 2 options, or even you could just rule out 1, but you should try to attempt the questions. So yes, I wasn't really scared of the negative. I just attempted.
So you attempted all the 300 questions?
No, not all. I attempted 294.
294,
yeah,
okay.
So.
And your marks, how much did you get?
So NEET, I scored 882.
882. So roughly, if you say it is near about 70 to 72% what you scored.
Yes, sir.
Okay. So now, if I say 70 to 72%, that means it is almost a correct of? How many questions do you expect from 294 to get correct? Roughly?
So I didn't.
Roughly 230.
Yes,
you will
yeah,
have. Okay.
yes.
So that means effective correct was 230, but you must have got correct 260 or 270.
I got a few negatives.
Yeah.
Yes,
now,
sir.
there is a very common question which students ask. Sir, we don't know all the 4 options.
Yes, sir.
How does a topper guess? How do they get it correct? And when we guess, we get it correct. What was your guessing strategy for an exam?
So, if there are very few questions in the exam where you might not be having any idea about the question or all the 4 options, there are very few, so it's better to leave them if you don't even understand the question. But usually they wouldn't be such, I mean, it's rare to have those questions. And ultimately, somewhere like you do get the answers from, you might have not read it just a week prior or just a few months. It might be there at the back of your mind. You might have had a discussion with your friend or in the class or anywhere in the entire 4 years, or even in the DAMS lectures you might have heard it. So it will click to you, it will come to you that this probably could be the answer. Then you also should read the question very well. What is it asking? So that way you can easily come to a particular answer, even if you might not be knowing the right, but you can figure out somewhere. It might click to you, and you should trust your intuition. You should trust your gut feeling.
Now, a futuristic question: are you going to prepare for the May session PGI names?
So I don't think so, because I feel that I did my best. I couldn't have done better as in terms of my preparation. Only in AIMS and PGI, because I started a little late, so I felt my revision wasn't complete. But till NEET, I was able to. I had a target of doing 3 revisions before the exam, and also quick brush up a week before the exams. I tried to do that. I tried to follow the tests. I performed well in the tests and the exams, so I'm content and I'm happy. So.
Now, your message for the students who are listening this,
Yes.
who have not done well in this exam, what is your message to them?
So my message would be like, this was one thing which was told to me even before I started preparing, that eventually you would get where you're supposed to be, you would land up. It's just a matter of time. And also one thing which I kept telling myself, that it's not it's not over. You're not. It's not over till you're done. So you should not stop. You should just keep pushing yourself. You should realize your capabilities and your caliber, and you should not compromise on that. So until you feel that you've reached your limit and you've got what you deserve, you should not stop. So keep telling yourself it's not done till it's finally over. So I would keep.
Your juniors, who are still in the medical school, who are probably interns, current interns, fresh, final year, 4th year, 3rd year, message to them.
So to the second, third, final year students, I would say, because I wasn't also a very keen person on cracking the exam at the first go. I was more enjoying the process of MBBS. Read good books, read standard books. Don't compromise on that. That time would never come. You can always read your notes and prepare for MCQs later on, but you should always try to build on your concepts and get the knowledge which you're getting, and also not to take too much of stress for getting into a PG field. Why should we be in a hurry? We should just enjoy the process, and we should just take it as an opportunity, a chance that we're getting to read all the 19 subjects once more before finally bidding farewell to them. So you can improve on that also. So I feel.
Now, last question for you.
Yes, sir.
So you see yourself as an?
So it's a difficult question. Though I see myself as taking up medicine, clinical medicine, but I feel I don't know, sir, probably radiology or medicine.
Okay.
Yes,
10 years down the line, a very successful doctor for us. We'll be proud of you.
Thank you,
And
sir.
it was an excellent session with you.
Yes.
And Prachi, I was very much happy that you spoke your heart, because there are many students who are probably going to listen to this or are listening,
Yes.
who have some basic doubts, which probably you have clarified to them at every juncture.
Yes, sir.
Yes, all the best, beta.
Thank you
Do
so
well,
much, sir.
and we expect to see you very successful.
Yes.
And guide your juniors, not only now, but probably when you grow up as a senior consultant or a faculty
Yes,
or
sir.
as a doctor. Okay, all the
I
best.
would love to
and
do
yeah,
that.
and
Thank you
enjoy
so
the
much,
trip.
sir. Thank you,
Nice
sir.
talking to you.